India is a booming economy. We are supposed to be the third biggest economy soon. Now, while we are launching rockets, while we are sending so many startups, we are known all over the world for our technology. We need to answer the question, why does a child still die of diarrhea in a village in India? My name is Dr. Sandeep Singh, and today in this video, I'm not going to talk about my core subject orthopedics, but I'm going to talk about the healthcare divide of India and how and why it should change, and that should change quickly. When we talk about healthcare in India, the accessibility to healthcare is very well defined by where you were born. So suppose you were born in a city like Delhi, Bombay, Bangalore, where you have all facilities in the world. You can get world-class treatment because you have access to MRI, CTs, you name it. You can have anything you want at your doorstep. I believe that the Indian healthcare system in a tier 1 or even tier 2 city now is the best in the world because you can get specialists, super specialists at the drop of a hat. But there's a stark contrast when we go to underprivileged areas and underserved areas. Now, if you go to a village, you go to a village in rural Odisha, you go to a village in rural Bihar, Madhya Pradesh, anywhere in Odisha, which is at least 70-80 kilometers away from the main center, you will find minimum or no basic services there. Now, that is the biggest killer in India. Now, that is the divide which we need to address. We need to understand that in India, 75% of the healthcare is surrounded in cities which are tier 1 or tier 2. But 70 to 80% of our population is not living in these cities. 70 to 80% population lives in the villages. Now, it is not about just geography. It is about the economics also. There's a big cost divide when it comes to urban and rural healthcare. Now, we need to understand that there are 60 to 80 million families in India who are just one sickness away from going into poverty. Data shows that over 63 million Indians are pushed into poverty just due to healthcare expenses. This is the reason we need to talk about more and more healthcare insurances, more government policies, because we need to provide cover for these people so that we can give services. For the poor, a simple fracture or a simple fever can mean choosing between medicine and food. Now, this is a very scary situation because they end up losing their lives over a small preventable disease. As a practicing orthopedic surgeon, I see this divide every day. I've seen patients who have come to us traveling hundreds of kilometers over 2 days, 3 days, sleeping outside hospitals, just hoping for a consultation. When you go and see these people, they have something which can just be treated by a couple of medicines. Now, that human being had to travel for 2 days just to get a simple prescription. Now, that is something which is not terrifying. It is sad because this should not be the state of a country which is sending rockets to Mars. Now, as I said, this tragedy is a betrayal of our constitution, which provides healthcare as a fundamental right. How much does the government spend on our health? 2.1%. In the developed world, let's take America for example, it spends about 16 to 18% every year on its health. What is the solution to this? Our people need more hospitals. Our people need a policy change. Now, we need to understand how our healthcare is framed. There is a primary health center, there is a CHC, there is a district health center, and there are government hospitals. The government thinks that there should be a good referral chain in between these centers, and there should be accountability, and there should be some services which should be given at every sector. Unfortunately, in practicality, what it happens is these centers are referral centers from one center to another, and in reality, they end up giving low or even low quality services. This is something which needs to change. However, the point of this video is not to depress you. At this point of this video is to tell you that there is hope. Now, there are some innovations which are coming in. I've seen a lot of government policies which are coming in. For example, the Ayushman Bharat mobile clinics, which are making sure that more and more people are inside this safety net so that people do not have to worry about money when it comes to healthcare. As a doctor, it becomes easiest for us if we do not have to differentiate human beings depending on their insurance. If we have a policy where every human being is same, the discrepancy that doctors might have or don't want to have or is forced on them will go away. We need to understand that as doctors, we do not try to see people as paychecks. We need to see people as an illness which needs to be cured. Be it a rich or poor person, urban, rural, every person deserves dignity, timely care, and a chance to live. Now, as Indians, what we should demand from the government is that we should get more investment in healthcare, especially government and rural healthcare, because that is where core India lives. Urban India is already well served. I think it is overserved. It is where the rural population is, which requires help. Now, how do we do that? Raise your voice. Through this video, I want to educate the general people that Healthcare will only improve if there is more funding which is directed to rural India, not to urban India. Rural India requires a overhaul, it requires emergency care, and if rural India gets the healthcare and the respect they deserve, India will be a more healthier, a longer living, and a more productive economy.